Alright, chemistry. Today we're going to be talking about analgesics, or as it's more commonly known, painkillers.
Okay, so an analgesic is a painkiller that doesn't alter perception or consciousness and doesn't block the conduction of nerve impulses. There are two kinds of analgesics. The first is anti-inflammatory. These analgesics reduce local inflammatory responses. They provide short-term relief and are best suited for the treatment of modest pain. The second kind of analgesic are opiates, which act on the brain. They provide long-term effects and are better suited for the treatment of severe pain. Anti-inflammatory analgesics mainly come from three compounds: salicylic acid, pyrazolone, and phenacetin. There are three major types of these anti-inflammatory analgesics, including aspirin, acetaminophen, and non-steroidal anti-inflammatory drugs, or NSAIDs. Anti-inflammatory analgesics inhibit prostaglandin synthesis. Prostaglandins are natural products of inflamed white blood cells which induce pain and inflammation. By inhibiting these products, analgesics reduce pain. So different anti-inflammatory analgesics produce a variance in COX, or cyclooxygenase, which is an enzyme that breaks down prostaglandin. This causes anti-inflammatory analgesics to have varying reactions depending on the type. For example, aspirin will reduce fever and inflammation, whereas acetaminophen and non-steroidal anti-inflammatory drugs mainly reduce fever. Okay, opioids. Opioids are substances including both natural and synthetic chemical compounds which are closely related to morphine. Opioids are both agonists and antagonists, meaning that they can both activate and block certain receptors in the brain. Opium, the powdered form of the dried poppy seed, contains alkaloids, which include morphine and codeine, two common natural opioid analgesics. How are they used? Opioid drugs are used to reduce general postoperative pain as well as severe pain. A very common opioid is morphine, which activates enkephalins, or naturally occurring analgesics pentapeptides, to reduce pain. This is an example of an agonist opioid. One example of an opioid is morphine. It has a chemical formula of 17 carbon, 19 hydrogen, and a nitrate. Its molar mass is 285.38 grams per mole, and it is an opium alkaloid. This naturally occurring compound is extracted from the dried milky exudate of the unripe seed capsule of the opium poppy flower. It occurs as colorless crystals or is a white crystalline powder. Morphine was first isolated from opium in 1804 by a German chemist named F.W.A. Serturner. After its isolation, morphine began being manufactured commercially in Germany in the year 1827. Then, after the invention of the hypodermic needle in 1853, morphine became an even more effective and available analgesic. This drug became popular largely for use during the American Civil War. At that time, opium pills were distributed to army surgeons, and morphine was commonly used for its effectiveness in dealing with painful shrapnel wounds and other battle injuries. Morphine has common uses mainly for the treatment of pain caused by cancer, and also in cases where other analgesics have failed. Morphine produces a calming effect and protects the system against exhaustion in cases of traumatic shock, internal hemorrhage, congestive heart failure, and debilitating conditions. Morphine is most frequently administered by injection for rapid results, though it can be taken orally to be just as effective. Morphine has side effects that include a relaxed, drowsy state, depression of the respiratory, circulatory, and gastrointestinal systems, and, in certain cases, morphine can produce a depressed mood. Several other analgesics can be derived from morphine, including methylmorphine or codeine, ethylmorphine, dihydrocodeine, dihydromorphinone, and emetic apomorphine. Because of its high potential for addiction and abuse, morphine is classified as a Schedule II controlled substance.
Alright, now we're going to move on to oxycodone. Here's some general facts about oxycodone. Its brand name is OxyContin. Its generic name is oxycodone. Its chemical name is dihydrohydroxycodeine, and its molecular formula, it has 18 carbons, 21 hydrogens, a nitrogen, and then 4 oxygens. Alright, let's talk about the history of oxycodone. Oxycodone was discovered in 1916, and it can be classified as an opioid. Now, this is because it is manufactured by modifying an organic compound called bane. And looking to its uses, oxycodone is used to relieve moderate to severe pain, and you can take it in several fashions: as an oral solution, an oral concentrate, an oral tablet, an oral capsule, or a compounding powder. And looking to its substance level, oxycodone was declared a C2 controlled substance in 1970. So, since it was discovered in 1916, it's been used for about a century now. Alright, let's get down to some side effects of oxycodone. Now, oxycodone is a prescription drug, so the side effects can range from fairly common side effects to rather severe side effects. More commonly reported side effects of oxycodone include pruritus, drowsiness, constipation, nausea and vomiting, weakness, diaphoresis, and xerostomia. And then some more severe side effects are included on the picture here, including hallucination, confusion, dizziness, loss of appetite, swelling and dryness of the mouth, hives on the skin, difficulty breathing or slow breathing, your eyes can swell up, lots of nasty side effects. Some symptoms of overdose include a change in consciousness, chest pain or discomfort, small pupils, so the black part of your eye, decreased awareness or responsiveness, extreme drowsiness or loss of consciousness, and no muscle tone movement or severe sleepiness. So the side effects can become very serious if you overdose. Now, moving from overdosing to some fun facts. Oxycodone is one of the many medications being abused today. This is because oxycodone is extremely addictive. Overconsumption of oxycodone can result in death. And a fun fact that's actually fun, oxycodone has a number of different names, such as Oxy, OC, Oxycontin, Killers, and my personal favorite, Hillbilly Heroin. Alright, moving from oxycodone to aspirin. We're just going to talk about its basic properties here. Its chemical name is acetylsalicylic acid. Its molecular formula has 9 carbons, 8 hydrogens, and 4 oxygens. And its molecular weight is 180.15742 grams per mole. And to the left is a picture of his Lewis structure. A little bit about aspirin's history. Where does it come from? Well, the chemical for aspirin is founded in the willow leaf. And willow was widely used as a medicine by ancient civilizations like the Egyptians since 3000 BC. And in 4000 BC, our good friend Hippocrates, famous philosopher, Greek philosopher, administered the willow tea leaf in order to relieve women's pain during childbirth. And who discovered aspirin as we know it today? Well, German pharmacologist Joseph Buchner in 1828 first extracted the pain-relieving ingredient from the willow plant and called it salicin. And then in 1899, acetylsalicylic acid is named aspirin by the pharmaceutical company Bayer. And aspirin later entered the Guinness World Records book as the most frequently sold painkiller around the 1950s. And around the same time is when the Take Two and Call Me in the Morning, that famous line, came into being. So what does aspirin do? Aspirin reduces the clotting action of blood platelets. So it does this by thinning the blood, and it can be used to relieve moderate pain, and it can also prevent arterial and venous thrombosis. Now, aspirin isn't all good. It has side effects just like any other drug. Some possible side effects include a stroke. Now, a stroke is caused by the bursting of a blood vessel. So daily aspirin may increase your risk of a hemorrhage stroke, or a stroke caused by excessively bleeding. And this is because, remember, aspirin thins your blood. And another side effect, or a possible side effect, is gastrointestinal bleeding. If you take aspirin daily, you have an increased risk for stomach ulcers. And if you have stomach ulcers, then even more aspirin will cause them to bleed even more. But don't fret, again, this happens if you take it daily and not sporadically.
Next we have ibuprofen, chemical formula C13H18O2 with a molar mass of 206.29 grams per mole. The category of ibuprofen is an NSAID, or a non-steroidal anti-inflammatory drug. Ibuprofen comes from isobutylphenylpropanoic acid. On this slide, we have a picture of 200 milligram ibuprofen tablets. To the right, we have the 2D structure of ibuprofen, and then below it, the 3D structure. Now for the history of ibuprofen. It was discovered in 1961 by Dr. Stuart Adams and marketed as Brufen. Dr. Adams started his career in medicine with a pharmaceutical internship at Boots Pure Drug Company at the age of 16. After his apprenticeship, he went on to get a pharmacy degree from Nottingham University, followed by a PhD in pharmacology from Leeds University. He returned to Boots in 1952, searching for a non-steroidal treatment for arthritis. He wanted to find a drug that worked the same way aspirin works, but that could be used in lower doses with fewer side effects and still be effective. With the help of his coworkers John Nicholson and Colin Burrows, he and his team tested over 600 chemical compounds, some of which he chose to test personally. In 1961, after 4 drugs failed clinical trials, Adams and his team finally settled on one called 2,4-isobutylphenyl propionic acid. It was patented in 1962 and sold on the market as a prescription drug 7 years later. In 1983, because of its stellar safety record, it became available as an over-the-counter drug. Ibuprofen is synthesized from the compound 2-methylpropylbenzene. Boots UK used a 6-step synthesis method that is displayed in the pictures on the slide. Ibuprofen has a variety of uses. Prescription ibuprofen is used for reducing pain, tenderness, swelling, and stiffness for 2 types of arthritis. The first type of arthritis is osteoarthritis, an arthritis caused by a breakdown of the lining of the joints. Rheumatoid arthritis is the other type of arthritis, and this is an arthritis caused by swelling of the lining of the joints. Non-prescription ibuprofen is used for reducing the effects of headaches, menstrual cramps, fever, muscle aches, toothaches, the common cold, and backaches. Some interesting facts about ibuprofen. Ibuprofen works by targeting hormones called prostaglandins to reduce pain and inflammation. Ibuprofen has many popular brand name versions, including Advil, Motrin, Nurofen, and Midol, which is a medication designed specifically to target menstrual cramps. Overdose of ibuprofen can damage the stomach and intestines. Common side effects of ibuprofen include upset stomach, mild heartburn, nausea, vomiting, bloating, gas, diarrhea, constipation, dizziness, headache, nervousness, and mild itching or rash. Next is acetaminophen. The brand name for acetaminophen is Tylenol, which is the most popular sold form. The chemical formula for acetaminophen is C8H9NO2. The chemical name is paracetamol, and the molar mass is 151.163 grams per mole. Acetaminophen history. Harmon Northrop Morse first synthesized acetaminophen in 1873, though it was not used medically for another 20 years. Acetaminophen was first created after metabolizing another drug called phenacetin. The name for acetaminophen comes from the chemical name of para-acetylaminophenol. The demand for acetaminophen rose from the need for an over-the-counter pain medication that children could take. In 1954, Robert L. McNeil Jr. did final labs and clinical testings to gain approval from the Food and Drug Administration. Now on to how acetaminophen is then marketed the product. Acetaminophen is made from the nitration of phenol. Phenol is nitrated to give a mixture of ortho and para-nitroylene. The O isomer is removed by steam distillation, and the P-nitro group reduced to a P-amino group. Then it is acetylated to give paracetamol or acetaminophen. Here we have a diagram showing how this is done. As far as uses of acetaminophen goes, acetaminophen is commonly used to treat headaches, fever, muscle aches, arthritis, backaches, toothaches, and the common cold. Some general side effects of acetaminophen include rash, physical weakness, hives, itchiness, fatigue, nausea and vomiting, and then more serious side effects include bloody urine, sore throat, abnormal bruising, jaundice or the yellowing of the eyes and skin, liver damage, swelling, and difficulty urinating and decreased volume of urine. Some final facts about acetaminophen include it's not good for muscle pain. It is found in more than Tylenol. It is easy to accidentally take too much or overdose. It is not a very effective way to fight a hangover. And unlike a spoonful of sugar, Mary Poppins, she's not right. This has to actually be measured.
Alright, and that's
Thanks for watching.